This is Dr. Mahesh Lakhe. I'm a physician, diabetologist, and infection specialist practicing at Kharadi, Pune. So, in the series of our hypertension and how to control your blood pressure, what medications to be used. So, what are the current concepts or current trends in treatment of hypertension in these couple of years? So, who should be screened? So, this is a very important pertaining questions, and it has been clearly studied, and now the recommendations are anyone is 18 years and above should be screened for hypertension or high blood pressure. How do I know if a patient has a hypertension? So official values may not be sufficiently sensitive. Consider home or ambulatory blood pressure monitoring. Ultimately, it's your call. So what is the role of 24-hour blood pressure devices like ambulatory blood monitoring, etc.? These may become gold standard for clinical categorization, but use in day-to-day practice may or may not become a standard of care at this point of time. What should be our targets for blood pressure control? So systolic blood pressure under 130 millimeters of mercury and diastolic less than 95 millimeters of mercury. Next question is, what about the non-pharmacological options like exercise? At least 150 minutes per week is essential. Your sodium intake should be less than 1500 milligrams a day. DASH diet, no condiments and dressing, etc. If you are taking suppose salad, or do not add those salad dressings, etc. Be careful about alcohol, because that is one of the important cause for uncontrolled hypertension. What are the preferred medications? So start with a thiazide, then add an ACE inhibitor or an ARB and or a calcium channel blocker. What is the emerging role of hyperaldosteronism? Hyperaldosteronism may become a common driver for hypertension in coming future. Should BP medications be given before bed? Consider for all patients and recommend for a patient on multiple medications. That is, if somebody is taking 3 or more medications for controlling BP, think of shifting it to at bedtime. What are our messages to ensure patients buy-in? Risk reduction. 22% reduction in major cardiovascular events for each 10 millimeters of mercury drop in systemic blood pressure is very essential and very crucial. Cognitive preservation is the long game. So if your blood pressure is controlled for long term, and then your cognition, your higher mental function, etc. will be preserved. So what are the important pearls or points? Your systolic blood pressure more than 120 is a call to action. Thiazide diuretics remain a cornerstone for hypertension therapy. Consider more home or ambulatory BP monitoring. Consider 24-hour BP monitoring. Consider more use of spironolactone. What could be the next step? Consider increasing therapies if systolic BP is more than or equal to 130, 135 or diastolic BP more than 95. Consider active therapy in your patients if they are like less than 40 years of age with systolic BP 130 and above. So this is sort of a summary for blood pressure control. This could be useful for the patients who would like to know more about the hypertension, or also for practicing doctors. We'll see you soon with some new topic which is essential for everybody's health. Maybe something about use of tobacco and the consequences like cancer, etc. You may tell us about what kind of topics you would like to listen from us. We would try to be as evidence based as possible, and based on our experience treating these patients will add more value to your knowledge. Thank you. Keep tuned.